Finding out a family member may have COVID-19 is really scary. You're probably really worried about your sick relative and everyone else in your household. Fortunately, it's possible to prevent the virus from spreading to other family members, even if you all live together. If you have any questions or concerns, talk to your doctor as soon as possible. Keep ill family members home unless they're getting medical care. Try not to worry about your sick family member because most cases of COVID-19 are mild. If your family member has COVID-19, they need to stay home unless they're seeing a doctor. Otherwise, they might risk infecting others. Make sure your family member stays at home except to see their doctor or go to the hospital. Give the sick family member a separate room while they recover. The best way to prevent the spread of COVID-19 is to stay away from people who are ill, but this is really hard if your family member is sick. To help you stay separated, make one room in your home a sick room. Keep the door of this room closed to help limit the spread of the virus. Then, keep healthy family members in a different room except for when you're providing care. Designate a separate bathroom for the sick person if possible. Since the COVID-19 coronavirus can live on surfaces, using shared spaces with an ill family member increases your risk of getting sick. If your home has multiple bathrooms, allow the sick family member to have their own bathroom while they recover. Ask all healthy family members to use a different bathroom in the meantime. Stay 6 feet, 1.8 m, away from your family member when in the same room. You're probably doing your best to care for your family member, so there may be times when you have to be in the same room. Germs from coughs and sneezes can spread up to 6 feet, 1.8 m, so it's important to distance yourself from a family member who's sick. When you enter their room or are providing care, do your best to maintain your distance as much as possible. Ask the sick person to wear a face mask while around others. A face mask can catch the droplets your sick family member releases when they breathe, cough, or sneeze. This reduces the risk of you and other healthy family members breathing in the droplets and getting sick. If your family member can wear a mask, ask them to wear it when they're around others. Don't share household items or utensils with your ill family member. You may be used to sharing items with your family member, but it's important to stop until they get better. When your sick family member uses items like kitchen utensils, dishes, and towels, those items are contaminated with germs. Sharing these items increases your risk of getting sick. Avoid sharing any items with a family member who's sick just to be safe. Keep visitors out of your home until your family member recovers. If someone in your house is sick, don't allow any visitors into your home. If you do, they'll be at risk of getting sick. Notify potential visitors that your house is off limits for the time being. Provide tissues to cover coughs and sneezes. COVID-19 spreads in droplets from an infected person's breath, coughs, and sneezes. Your sick family member can limit the spread of these germs by covering their coughs and sneezes with a tissue. After they cough or sneeze into a tissue, ask your family member to ball up the tissue and put it in a lined trash can for disposal. Wash or sanitize your hands often. You might catch COVID-19 if you touch an infected surface and touch your eyes, nose, or mouth. To clean germs off of your hands, wash with soap and warm water for at least 20 seconds after touching anything, before eating, and before touching your face. If you can't wash your hands right away, apply a coin-sized amount of hand sanitizer to the palm of your hand and rub your hands together until the sanitizer evaporates. Don't touch your eyes, nose, or mouth unless your hands are clean. Your sick family member will release germs when they breathe, cough, or sneeze. These germs can live on surfaces in your home for a period of time. You might catch COVID-19 if you touch an infected surface and then touch your eyes, nose, or mouth. To be on the safe side, wash your hands if you need to touch your eyes, nose, or mouth. Wear a face mask and gloves while caring for your sick family member. Protective gear will help you avoid getting sick. When you're finished providing care, remove your gloves first so you don't accidentally touch your face while wearing them. Dispose of the gloves, then wash your hands for at least 20 seconds before you remove your face mask. Discard a disposable face mask after use or immediately wash a reusable mask in soap and hot water. Have healthy family members care for children and pets. Sick family members shouldn't be caring for anyone else, including children, because people in their care may get sick. Similarly, the CDC recommends that people with COVID-19 not care for pets, just to be safe. If someone in your home is sick, make sure only healthy family members are doing caregiving activities. Get groceries and other necessary items for the sick person. Since your sick family member can't leave home, it's up to you and other loved ones to get supplies for them. If you live with the sick family member, it's best to get food, medical supplies, and other household items delivered to your home. If you don't live with the family member, drop off the items at your sick family member's home. Ask your doctor if you should self-quarantine for 14 days. If your family member has COVID-19, it's likely that you've been exposed to the virus by being around them. While you hopefully won't get sick, it's best to stay home and distance yourself from others until you know for sure you aren't sick. Typically, quarantine periods last 14 days, as that's how long it might take for symptoms to develop. Talk to your doctor to find out if you need to self-quarantine. Clean high-touch areas every day. Try not to stress out too much about cleaning, but disinfect high-touch surfaces at least once a day. Since germs can survive on surfaces, it's important to disinfect common areas often. Use a bleach-based cleaner, Lysol, or a disinfectant that's labeled for use on viruses to clean your home. Treat high-touch surfaces like doorknobs, countertops, faucets, toilet flushers, light switches, phones, desks, and keyboards every day. Wash dishes in hot water and detergent. If you're using a dishwasher, choose the hot setting to help kill germs. If you're hand washing your dishes, use water that is comfortably hot to the touch but not scalding. Use dish detergent to ensure the dishes are clean. Wash laundry on the highest setting recommended on the label. Check the label on your clothes to find the recommended wash settings. Then, wash the items with laundry detergent on the hottest setting possible. Open a window to ventilate shared spaces on good weather days. Good air circulation helps limit the spread of COVID-19 because germs might linger in the air. While your family member is sick, open the windows of your home if you can. This will allow fresh air inside, which might help you avoid getting sick. Call emergency services immediately if you notice signs of trouble breathing. Try not to worry, but COVID-19 can cause serious symptoms. If this happens, call emergency services immediately to get help. Tell the dispatcher that your family member has COVID-19 so they can take precautions. Watch for the following severe symptoms: difficulty breathing, pain or pressure in your chest, bluish lips or face, confusion or trouble rousing. Thanks for watching. Please subscribe, like and share.